Welcome to this presentation for the variable rate insulin infusion protocol. This is a protocol that will be used on the wards independent of the DK and HHS protocol that people are already familiar with. It has been noted that IV insulin use independent of the above the protocol has been problematic, and in a recent survey 100% of Regis and SPR in UHG thought it would be useful to have such a protocol. This protocol would be used as and when directed by the diabetes and endocrinology team, but oftentimes we use it when we see hyperglycemia and a patient being NPO, with the common factors taken into consideration being on TPN, enteral feeding, high dose steroids, and severe illness. Again, the warning comes with asking for specialist advice before using it, with a warning that the majority of acutely unwell patients do not need a VRIII. You should consult the diabetes team, who may be well able to adjust the patient's own insulin regime to get good diabetes control. Proceeding on to the protocol itself. This would be found on QPulse by searching for variable rate IV insulin infusion. You should not be able to get that if you look for DK or HHS. The first page is a guide to ensure that this protocol is not used for patients who should be on a DK or HHS protocol, and should the patient be indicated for variable rate insulin infusion, the next two pages walks you through prescribing the insulin. We would continue any long-acting insulin if the patient is on same. There's 3 scales that are pre-printed. Scale A is a reduced insulin rate, Scale B is a standard insulin rate, and Scale C is an increased insulin rate. We'll go through that as we go through the guideline. There's a brief indication of how to prepare the insulin infusion and potassium replacement should it be required. The warning at the bottom covers how often blood sugar should be tested, how often ketones need to be tested, and regular check of potassium is recommended. The primary team is expected to prescribe the IV fluids according to the patient's needs. Should there be hypoglycemia in a type 1 diabetic, the recommendation is only to go to a minimal rate if the patient has not received their basal insulin. The following page is a record keeping of the blood sugar, ketone levels, and insulin administration while on this protocol. I'll proceed on to the guideline. As expected, the guideline is a more in-depth document covering the purpose, the definitions, the roles and responsibilities. It covers how to set up a VRIII, what sort of insulin rate prescription. As described previously, a standard rate would be used for most patients. If you think the patient is insulin sensitive, you go for the reduced rate. On the protocol, it would be rate A, and if the patient is likely to be insulin resistant, the rate C can be used. There's a 4th column that can be a special rate prescribed as indicated. This part covers what to do in case of hyperglycemia or hypoglycemia. Treatment can be customized as the patient are different, and indication for use can be very specific. Hypoglycemia treatment is covered with a special warning not to stay off the variable rate insulin infusion for an extended amount of time after hypoglycemia is treated, as the insulin goes out of the system once disconnected after about 20 minutes. Monitoring is recommended with hourly blood glucose review of insulin rates to achieve target blood glucose control and to just test for the need fluid electrolyte replacement. In stopping the VRII, we have two main differences for the insulin treated patient. Insulin needs to be restarted subcut, and VRI can only be discontinued 30 minutes afterwards, whereas for non-insulin treated, given normal treatment, the VRI can be discontinued. We will audit this protocol and follow through with it. Thank you for your attention.